Hi YouTube, my name is Carmen. I'm getting ready to do the Roux-en-Y in 10 days. Today I was talking about being on the liquid diet with a coworker, and she asked me, why don't I just eat like that all the time? I should lose a ton of weight. And kind of got me to thinking about it. Because I've done Weight Watchers probably 4 times over the last 15 years, I'd say. I went to a diet doctor who prescribed, I think it was like metformin and B12 shots and some other stuff. He basically said, actually, people don't need to eat food, which I kind of thought was a weird thing to say, but that didn't work. I tried the HMR shake diet. So I've done, quite a few things over the years. And even now, I've been on this, been going to the weight loss center, preparing, because my insurance, I have to go for 3 consecutive months, which actually is 4 consecutive months, because one of the months is considered the initial visit, which doesn't count for the 3. And so I've been using my FitnessPal and logging all of my food, and I did just the resting metabolic rate, just based on height and weight. It wasn't like the actual test that you can have done. I walk almost, just counting my route, I'm a male lady, I walk almost 13 miles. I don't count any of the other walking, just my route. So that's 5 or 6 days a week. And I've had that route for, I'm going to say, 5 years now. Before that, I did a variety of other things. I'm definitely walking more now consistently. There'd be days when you'd walk a couple, I was a substitute swing carrier, so I had different routes every day. So for whatever reason, I have a hard time losing weight. I've been on the liquid diet, and I was trying to explain to her, sometimes everybody has different issues, and some people can deal with one issue better than another person, and that's just how I think we're designed as people. And I was thinking, so am I making excuses that I wasn't able to lose the weight? I'm not reconsidering the surgery because I've really been thinking about it for quite a while. And I know that really seems to be the perspective of some people. Especially people who maybe don't quite understand why a person would have weight issues. I think people think that you just fill your face with Snickers and Coca-Cola, and no wonder you're fat. I think it might be a little bit more complicated than that, although that probably could be part of the problem. And so I was just kind of thinking about that. Is it an easy way out? I don't actually think it is. It's pretty extreme to be considered an easy way out. I do know that I've been on the liquid diet, and just to maintain my weight as it is now, I could basically eat like 2,300 calories a day. And so I'm eating like 1,300 with the shakes and one solid meal, and I've been eating a yogurt too. And I don't think I've lost my weight. I'm still the same weight I was 2 weeks ago before I started. And over the last 3 months, I've lost like 6 pounds, 5 to 6 pounds, because I keep toying with that 1 pound. I quit drinking pop. I really started increasing my vegetable intake. I don't eat carbs very much. I mean, I eat some, but usually like a cafe steamer, lean cuisine, so it's got, 3 tablespoons full of rice, and it's not very much. And, like I said, I'm walking 13, 14 miles a day. So I'm not so sure that that is completely through the fault of not choosing the right foods. I guess that's kind of what I was curious about. Anybody else's experiences with people. And I'm not upset with her. I think it's just coming from a place of trying to understand why I'm choosing to have a surgery, yet I'm dieting, which I think seems strange to her, maybe to other people too. So I was just curious what everybody else's experiences were with people saying kind of like, maybe like something, I wouldn't say offensive, because I think that's silly to be offended by things like that, but it's really coming from a lack of knowledge about that particular situation. So I think that's it.